Hello students, welcome to Science and Tech Updates with Dr. Vivek Rana. Topic for today's discussion is from health sector. We all know in UPSC prelims examination, there is always a bright possibility of question being asked from diseases which are making headlines. Even though in our biology class lectures, we have a dedicated lectures in which we typically cover almost all major bacterial, viral, fungal and protozoal diseases. But apart from that, we also have to cover diseases from current affair section as well. So we'll be decoding a disease which has made headlines, but this time for all the positive reasons. So India has achieved a major health milestone by eliminating the dreaded disease of trachoma. So you need to understand what exactly is trachoma, which is a system or part of the body which gets affected by this disease. What are the causative agent and is there any treatment available, and what is the overall significance of this milestone? So trachoma, first of all, you have to understand it is a eye disorder which is one of the leading cause of blindness worldwide. Still, there are over 38 countries where this disease continues to create havoc with the eyes of patients. But India has finally been certified by the World Health Organization that it has finally eliminated trachoma. So India has become third country in Southeast Asia region after Nepal and Myanmar to achieve this, you could say, significant milestone. So you should mug up the exact bacteria name as long as some new disease comes into the picture. So the name of bacteria is Chlamydia Trachomatis. So it's mentioned for your understanding. In case you are having difficulty in mugging up this name, you could also memorize it as C. Trachomatis, or you could only just memorize that Chlamydia. Even though the scientific names are rarely asked in, you could say, competitive examination, but still you need to be absolutely clear about the particular causative agent. They will try to just mix it with other viral because there are certain diseases which are associated with viral as well, and they might try to mix up with other, you could say, infectious disorders as well. Now, typically, this disease affects mainly children, and in adult also at times 30 to 50 age is another age bracket where certain times this disease has been associated. Now, the mode of transmission is straightforward. Typically, due to poor sanitation, unhygienic conditions, a person might get infected by this bacterial infection, and then the eye discharge starts. So typically, due to, you could say, direct contact is the exact word through which this disease transmits, as you could see on your screen as well. They might have mentioned through personal contact. So hand, clothes, and bedding are the strong, you could say, risk factors which are, if not cleaned properly, disease can be transmitted to the second individual. At times, their role of vector is also associated with it. The common flies, the house flies, at times, they might accidentally sit to the infected person and come in contact with the eye discharge or nose discharge and accidentally transmit it to some other individual as well. So basically, the sanitation hygiene is the one of the preventive aspect of the disease, and we should be meticulous in our cleaning habits. Then coming to the symptoms, there will be the itching of eyes, eyes will turn red, there would be eye discharge, and the most peculiar symptom which is commonly asked in exam is there is inward, you could say, bending of the eyelids. So these eyelids tend to just directly come in contact with the conjunctiva cornea part, and it starts triggering an irritation and, you could say, itching sensation, and in indirect way it damages cornea and can be the cause of blindness as well. So eye pain, light sensitive, eyelid swelling, mucus discharge are the specific symptoms, but drooping of eyelids is what you have to just memorize from prelims point of view. They will say which eye disorder is peculiarly associated with drooping of eyelids. It has to be the trachoma. And the risk factor which has been attributed is once again the poverty, because primarily we have seen that in extremely poor population, due to poor sanitation hygiene, the bacteria thrives in some contaminated places, and there is a risk factor aggravates many folds. Apart from that, the crowded living condition, there is a risk that disease can get transmitted among children which are playing among others. So the inflammation of eyes and the thickening of upper eyelids are the things to be memorized. And since it's a bacterial disease, treatment could be with any strong antibiotic like azithromycin, or you could say tetracycline. And this is all you had to mug up from the disease. So this is a quick health update in which we had just decoded the key, you could say, the symptoms, causative agent, treatment aspect. There is no vaccine as such of this particular disorder. Now, whenever such questions are asked in civil service examination, they tend to confuse this topic with other eye disorders, which are mentioned in your NCRTs. So make sure while updating this current part, you should ideally go through the conventional eye disorder part as well. First and foremost could be the nutritional deficiency, which leads to, you could say, dim vision at night time. Yes, you guessed it right. I'm talking about the night blindness, because that's vitamin A deficiency, which was once again in news in last 6 months, because Philippines had change of heart. Initially, it allowed golden rice to get approved, and eventually it took that decision back because of some, you could say, controversies. So make sure you are clear about the role of rod cell, cone cells in the eyes, because the rhodopsin, iodopsin pigment are associated with vitamin A, or you could say beta carotene. Apart from that, genetic disorder are also in news, because we are seeing rapid strides being made in gene therapy as well as gene editing experiments, and inherited genetic disorders associated with eye, particularly color blindness, could be treated with such intervention. So make sure when they ask you about color blindness and person is having difficulty in differentiating primary colors, the gene therapy is the mode of treatment. Coming to the main topic from which the highest questions have been asked in civil service examination, it continues to be refractive disorders of eye. Make sure you are clear about what exactly is myopia, what is hypermetropia, what is presbyopia or astigmatism. And you should have clear what exactly are the reasons for those disease, and what are the exact lenses, whether it's the convex or converging lens, or diverging or concave lens, which would be the remedy. So all these themes are covered in our general science lecture, so we are not repeating in this quick current affair update. And apart from that, when we do science and tech, there is a mention of cataract disease, which is still continues to be one of the leading cause of blindness worldwide. And we all know Shushruth was the first surgeon who tried to decode it with surgery. So you have plenty of, you could say, eye disorders, which examiner might tend to confuse you with either the reasons or with the causative agents. So make sure you are able to differentiate nutritional deficiency with infectious disorder from a genetic disorder or from refractive disorders of. So I hope this quick update on eye, you could say, was useful. And apart from that, there is no harm in going about the layers of eye, what exactly is the role of cornea, pupil, retina, and what is the role of optic nerve, and why the cornea transplant is so common. So make sure all these facts you are clear through your NCRTs or through your class lecture as you deem fit. So this is all we had in today's health milestone, because this is another health achievement which goes to the credit of India's emerging, you could say, might in medical tourism. And also you could say such symbolic milestones at times keep the ante up for our health, you could say, professionals as well. So keep following updates on our channel for more such current affairs. We will be back soon with another current update. Thank you very much. Have a nice day.